Hi, my name's Dilza. I'll be conducting the interview today. Just going to be asking you some pre-screening questions, if that's all right with you.
Okay.
Nice to meet you. What's your name again?
Saudi.
Zaldi. Alrighty, so we're going to get right into it. Going to be writing some info down. Going to get you to answer some questions, okay? So, Zaldi, last name? Full name?
Zaldi Gionzon.
Okay, nice. Date of birth?
20 April 1964.
20th of April, 1964. Gender, male.
Course.
Okay, so we're just going to get straight into it, if that's all right. So, first question. Has a medical practitioner ever told you that you have any heart conditions, or have you ever suffered a stroke?
No.
No. Do you ever experience unexpected pains or discomfort in your chest during physical exercise or activity?
No.
No. Do you ever feel faint, dizzy, or lose balance during physical activity or exercise?
No.
No. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
No. If you have diabetes, type 1 or 2, have you had trouble controlling your blood sugar, glucose, in the last 3 months?
I have no trouble controlling with it.
So you have
I have diabetes type 2.
okay, but have no trouble controlling it?
No trouble controlling with it.
All right. So, do you have any other conditions that may require special considerations for you to exercise?
No, not that I know.
Okay. All right, so we're going to get into more depth about these questions now. So, describe your current physical exercise levels in a typical week. So, I'll lay it out for you. We describe it off of intensity, and then frequency, and then duration. So, intensity, we have light, moderate, and then we have a high, vigorous. I'll give you a rundown on what each means. So, light would be less than 55% your heart rate, maximal heart rate. So an aerobic activity that does not cause any noticeable change in your breathing. Then in the next section we have moderate. This is aerobic activity that will be conducted that is hard to maintain a conversation. So you light jog, you can't speak anymore, that would be moderate. Obviously we have vigorous. This is where a conversation can't be held anymore, where you can't speak. High intensity aerobic activity, which is difficult to talk at all. So what would you say your intensity level is at with your exercise?
I think I'm in the moderate range.
Moderate. Okay, so now we have frequency. So this is how many times a week you work out, would you say?
Just say 2 or 3 times a week.
2 to 3 times. Duration. So how long are these sessions? You'd say
Maybe 30 minutes per session.
30 minutes? Okay. So I'm just going to quickly calculate your total minutes altogether just to see where you're at for the week. So minutes of light. How often would you say you only partake in moderate exercise, you'd say?
Yes.
Okay. So we're looking at about 60 minutes per week. Does that sound about right?
Yeah.
Alrighty. So we're now going to move on to stage 2 of the questionnaire, if that's alright. So we just want to get your age, to see the demographic where you're at.
Okay.
So age would be
60.
60 years, male. Alrighty, next question. Do you have any family history of heart disease? Has anyone ever experienced stroke or heart attack or a heart attack?
Well, my late father had a heart attack, but that was about maybe 15 to 20 years ago.
Okay, would you say that runs in the family at all, or was he the only member of your immediate family that had any heart issues?
Yeah, he was the only member of the family that had a heart issue. because he already passed away about 15 years ago.
Okay, nice. So how old was he when he had this heart attack? So at
Was
his
70 plus,
70 plus. All right.
and he died about 85, like that.
Okay. Do you smoke cigarettes on a daily or a weekly basis, or have you quit smoking in the last 6
No.
months? Okay. So we're gonna ask questions about body composition. Do you know your weight in kilos?
70, 71 kilos. Yeah, I remember.
Okay.
71 kilos.
Typically for a male around your age, it's around a bit higher, 75 to 80.
Mhm.
So,
I remember it was 80.
okay.
Yeah, it was 80 kilos.
80 kilos, okay. Do you know your height in centimeters?
5'7". So what is that?
5'7". That's
Times
approximately
100.
152 centimeters.
Yeah.
All
You
right.
calculate if you have the calculator.
Okay.
Mhm.
Yeah, that's 152 centimeters.
Okay.
Do you also by chance know your BMI, so your body mass index?
No, I don't know what's that.
So we can actually work this out for ourselves.
Work it out.
So basically, we just divide the weight in kilos divided by height in meters.
Yeah.
That gives us, I'm going to look at my calculator, a BMI of 34.6.
Okay.
Okay. Do you know your waist circumference?
Maybe 33.
33. Okay. Lovely. All right, we're going to move on to the next question now. Have you ever been told that you have high blood pressure?
No.
No? All right. No. Are you taking... Oh, no, so we can skip along. Number 13. Have you ever been told that you have high cholesterol / blood lipids?
No. I had cholesterol at one time, but
High cholesterol, okay.
Yeah, but
How long ago was
that
this?
was long ago. That was
Approximate how many years would you say?
Yeah, that's about maybe 15 years ago.
15
That
years
it
ago.
was already controlled, and it is within-
Controlled over the course, or now is it controlled?
It's controlled already since the years that I mentioned to you.
Okay.
And I maintained Lipitor. As
Lipitor.
my
So
medicine.
you, yeah, that moves on to our next question. Are you taking any medication for this condition?
Yeah.
So you've been taking Lipidors?
Lipitor.
Lipitor. So you've been taking Lipitor for 15 years now?
Yeah.
How often would you...
It's
how
once a
often do
day.
you take...
Once a day.
Once a day? How many times a week do you take these Lipidors?
Every day.
Every day?
Yeah.
Okay. Also, by chance, would you know your total cholesterol?
I don't know the measurement, but
Do you have a rough idea, estimate maybe?
no, I don't know how it was measured, but it's within the normal range.
The normal healthy range.
Healthy
Okay,
range,
lovely.
yeah. I think it's below 10. Yeah.
Below 10?
Yeah, something like that.
Okay, I'll write that down. So, do you know your triglycerides?
I don't know.
It's around the same measurement as
Yeah, I can-
total
I can-
cholesterol.
I
You
can
can,
remember.
okay, that's all right.
I don't even know the details of how it was measured.
So I'm guessing you don't know HDL,
Yeah.
LDL either.
No.
Okay, that's all right.
Yeah, those are highly technical
Yeah.
medical terms intended only for health professionals like you.
Yeah. So anyway, going back to that question, are you taking any other medications besides your Lipidos for high cholesterol, or have you?
For the high cholesterol?
Yeah.
Only the Lipitor.
Okay. So we're going, and that's working well for you now.
Yeah,
It's effective?
It's very effective.
Alright, so you'd say it's implemented into your everyday routine.
Yeah, it's my
Going
everyday
well?
routine.
Nice. Stuck in.
Yeah.
Next question. Have you ever been told that you have high blood sugar, glucose?
Yes.
Yes. So, if known, do you know your fasting blood glucose level?
It's 7.3 or 7.2 the last time I had.
7.2.
Yeah, that was last month.
last month. Okay. Are you taking any medication for this condition?
Yes, I'm taking Zig Duo tablet and Rhizodeg
Rhizodeg.
injectable.
Injectable.
That's the insulin or
Just to get some more, a grasp and more details about this, how often do you take these medications?
for the Rhizodeg, that's I have to inject every day.
Every day. How often a day?
Once a day,
Once a day.
and I'm taking about 60 units
60 units.
per injection.
So you have this every day.
Every day.
Okay. So again, implemented into your everyday routine.
Yes.
Pretty stuck in there. Working well for you?
Yeah.
Had no problems with a medication before? Having any side effects?
No
or?
problem. No.
Right. Lovely.
Everything good.
What about the Zagado tablets?
Zigdo, that's
Zigdo.
once a day.
Once a day, every day.
Every day,
Yeah.
and I've been taking it for the past 1 or 2 years already.
Also quite recent.
Yeah, because before that there was another medicine
Did you have
that
any?
was replaced with Zigdo.
Oh.
So I already forgot the name, but
So no complications with Zigdo.
no complications.
Alrighty. Going to the next question now. Are you currently taking any prescribed medications aside from all that other medications that we just talked about for your other conditions? No.
Only the Zigdo, the Rhizodeg, and the what's that I mentioned? Lipitor. Yeah,
Yeah.
that's it.
Nice. Have you spent any time in the hospital, including day admissions for any condition, illness, or
Yes.
injury? Yes. Okay. What would that condition be?
It's
Why
the
would you?
removal of my lump in the forehead.
Okay. So, just to get some background on this, how serious of a condition would you say this was?
It's not really serious, but because it was just a day surgery, and it healed within a week.
Also, fast recovery, you'd say.
Fast
Hasn't
recovery.
affected you over the duration of until up to now. Hasn't given you any
No,
problems.
it hasn't given me any problem.
So full recovery, doing well.
Recovery within 1 or 2 days, but
Wow.
the healing of the forehead was about 1 week.
1 week. So would you say that affected you in any way to do physical activity, exercise?
No, never affected.
Okay. Next question. No. Pregnancy question. Do you have any diagnosed muscle, bone, tendon, or ligament joint problems
No.
that could affect you anyway to exercise? No? Okay. And that is the pre-screening questions done. Thank you for your cooperation. Really appreciate it. I'll get back to you. Thank you, Zaudi.
Yes, those